trigger point and manual therapy can melt the muscle knots immediately. Learn more about the synergy of a broad management approach. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I want to discuss trigger point therapy and a broad therapy approach with you today. Now, I hope you'll consider sharing this video with your network because I swear to you, at least one of them could use this information. Have you ever had a goal, but there were several paths to reaching that goal? Now, some will take just one path and hope to reach the top of the mountain that way. And maybe there's a struggle or a challenge or a roadblock, maybe a setback along the way, and they just never seem to get there. And sometimes they just give up and decide that the goal is unattainable. Others might recall that, hey, there are actually several paths to the mountaintop, so they try a different route. Some will get there eventually. Some will run into the same fate, the same roadblocks, and once again give up in despair and disappointment. But what if you could combine all paths into one big highway and drive your car right up to the mountaintop, park it in the driveway, and walk in, sit on the couch, turn on the TV, kick up your feet on the coffee table? Wouldn't that be nice? Now, how does this have anything to do with our topic? Well, we know that the American College of Physicians, the world's largest medical group, recommends a broad treatment approach to treat pain. And that means there are many paths that can be taken to treat pain. And it's usually not just one single route that gets you to being pain-free. It's several paths taken all at the same time, a broad treatment management. And that means that treatment should not just be medicine, not just exercise, not just a chiropractor, or not just massage, acupuncture, decompression, or laser, or all of the stuff that we have here at the clinic. It's not just one thing. It means a combination of any or all of them working in synergy to reach the eventual goal of getting a patient out of pain as quickly and as inexpensively as possible. Now that brings us to the topic at hand. Combining manual therapy and trigger point therapy to get you to your goal. Manual therapy can be chiropractic, physical therapy, exercise, massage, even acupuncture, soft tissue stretching, and working to increase range of motion, strength, and stability. That's all manual therapy. Trigger point therapy is using medicine to treat the knots in the muscles. Now, most patients are pretty familiar with manual therapy, so let's skip that for this video and let's address trigger point therapy specifically. Many times, those with persistent pain, they require medical treatment. The first thing to know is that it doesn't hurt at all, okay? That's the first question everybody wants to know, and I'm happy to share with you that having used trigger point therapy myself, it doesn't hurt at all. At least, it didn't hurt me at all. Now that we've addressed the elephant in the room, let's cover the specifics of what trigger point therapy really is. According to the Cleveland Clinic, trigger points are the knots in a muscle that form when the muscle can't relax. Muscle knots are essentially highly sensitive bundles of fibers in tight bands there in the muscles. You can usually feel these knots when you're rubbing your muscles. They're typically sore and tender to the touch. Trigger points can even irritate the nerves near them, which causes referred pain, so that the patient actually feels the pain in another part of the body. They go on to say that a trigger point injection can help soothe muscle pain, especially in the arms, legs, lower back, and in the neck. It can also be used to treat fibromyalgia, tension-type headaches, and myofascial pain. A lot of people really suffer from fibromyalgia and tension-type headaches. So here's what to expect. A healthcare provider locates the trigger points and then marks them with a little pen or a Sharpie. You can have several trigger point injections in just one setting if that's appropriate and necessary. But then the provider sprays a numbing spray on the area so that there is little to zero discomfort with the injection. Then the provider uses a small needle to inject a solution of lidocaine into the trigger point. And that's it. Lidocaine blocks the pain receptors in the muscles. With most, the trigger point is simply made inactive and the pain can be alleviated. Now, some patients may actually require a brief course of treatment to achieve sustained relief from the trigger points, maybe 2 or 3 injections over the course of 2 or 3 weeks. So what causes a trigger point? Well, according to WebMD, possible causes of myofascial trigger points can include injury or trauma to the muscle, repetitive motions, kind of like sitting in the same position all day or performing the same motions at work day after day after day, poor sustained postures, such as having a desk job, or with younger patients, they're on their electronic devices for extended periods of time. That can cause trigger points. And then psychological stress. Current leaders and experts in this realm, they agree that for some patients, trigger points begin in the brain rather than in the muscle tissue itself. WebMD says that in addition to referred pain, a person with myofascial pain may experience the following: pain in specific parts of a muscle, pain that intensifies when the person moves or stretches the affected muscle, muscle knots that the person can feel by touch, muscle stiffness or weakness, or a limited range of motion. A lot of us are familiar with that, especially the older we get. Now, are there any risks to trigger point therapy? Well, the real risk of any complication from something as simple as a trigger point injection is very low, exceedingly low. It is highly rare to experience things like bleeding or an infection or anything like that, although a few may experience some slight soreness or numbness at the site of the treatment. Now, trigger point injections can be used for anyone and everyone with muscle knots, but are commonly used for patients suffering from things like fibromyalgia, tension-type headaches, chronic pain, persistent pain, pain that has failed to respond to other treatments, and myofascial pain. Now, do trigger points really work? Trigger point injections can offer immediate pain relief and improved flexibility and range of motion for the patients that have been suffering from chronic pain. Everyone is different. All conditions are different, and all patients respond to different treatments, guess it, differently, right? For that reason, what works for many may not work for everyone. Some have immediate pain relief that never returns, while some require a brief series of injections over a 2 to 3 week period, as I mentioned. Some only get relief for a few hours, then it comes back, although that is less common. But in summary, trigger point injections can be a safe and highly effective addition to our patient's treatment regimen right here at Creekstone Integrated Medical. By having so many paths here at Creekstone Integrated Medical to being pain-free, we've got it all under one roof here. We're more capable of creating that huge highway that leads to pain resolution for our patients. Now, if you think we can help you, call us at 806-355-3000. Let's get you on our schedule. If you're on YouTube watching this, subscribe, comment, and share. Same goes for Facebook. Your friends and family could really use this information. So we would appreciate it, and I'm sure they would too. Until next week, take care. We'll see you then.